With COVID-19 restrictions changing across the country and new information about the virus and vaccines coming every day, chances are you have a lot of questions. To help us answer some of them, I want to bring in CTV's medical contributor, Dr. Marla Shapiro. Good morning, Dr. Marla. Nice to see you. So let's get to our first question. This is from Antonella. She says, I was going to pull the kids out of school 2 weeks before Christmas so they could see their grandparents for the holidays, essentially, I guess, going into quarantine. She's wondering if that's a smart move, Dr. Marla.
Well, I think looking at the guidelines across the country, depending on where you live, we probably would say no. Although it sounds like a good idea, that quarantine would have to be every single family member, absolute, not leaving the house, and really being in lockdown before that type of exposure happened. We're getting so close to the end. We can see lights at the end of the tunnel with vaccines. So we don't really want to take missteps right now as we're coming, hopefully, out of this, very, very high number time.
Okay. The next question is from Paul in Edmonton, and it's about vaccines. He says, if I have been cautioned not to do the flu vaccine because of my allergies, what are my chances of being able to take this one for COVID?
Interestingly enough, a lot of people who think they can't take the flu shot because they may have an egg allergy actually can take the flu shot. But the messenger RNA vaccines that have presently been developed, the two candidates that we've heard about, are not developed in eggs at all. So depending on what your allergy was, I don't think it would be the same with this.
Another question about vaccines. What are the long-term side effects at the moment, if all they can assess in the clinical trials are the current side effects of the vaccine? What happens to our bodies in 5, 10, 20 years? This is a question a lot of people have, Dr. Marla.
Of course, it's a question that a lot of people have because of the speed with which the vaccine has been developed. It's getting our immune systems to develop antibodies. It's encoding it with a little message that looks like a spike to develop antibodies to the spike. So although it seems very specific, and in the short term, we've seen very good safety data, we cannot imagine what the long-term results would be. Based on the science, we're seeing very good short-term safety, but it's only time and time alone that will tell us whether or not there's any safety signaling that's happening. And clearly the vaccine will be in use before we have that data. So this is a very novel experience that we're all undertaking in terms of the development and the uptake of the vaccine.
Okay, the next question is from a senior. I'm a 73-year-old living in an apartment. I've been keeping all the windows open and follow all the measures. Is it a good idea to buy a portable air cleaner with a filter?
Well, you're doing a great job with the mitigation strategies. So the answer is not really. You can if you want to. It's a personal decision, but there's no clear scientific evidence that adding this in will make a difference. Sounds like you're doing everything correctly, and opening the windows is always a good idea.
Okay, and one last one from BC. Tom asks why we do not have antibody testing available in that province so that those of us who had symptoms early on were not tested and can confirm whether or not we had COVID and therefore have antibodies.
So firstly, we don't know how long the antibodies will last. So it's possible you could have had COVID and still test negative for the antibodies. Even those who have antibodies, although it's rare, we've seen reinfection with the virus more than one time. So it really doesn't tell us anything about long-term immunity. So the idea of seeing that there's antibodies and feeling like I'm immune and I don't have to do any of the strategies is not scientifically founded at this time. So we're really not sure what the antibody tests actually tell us in terms of the long-term immunity. As to when BC will have it, that's something that will occur at a provincial level.
Okay, Dr. Marla, thanks for all that. Good questions, good answers. Appreciate it. We'll see you soon.